Dr. Martha Whyte is the Regional Medical Director for the Office of Public Health, Region 7, which is us. Hey, Dr. Martha, welcome to KEEL. How are you this morning?
I'm good. How are y'all?
We're worried about
Well,
brain-eating amoebas.
Okay, let's let Aaron can on occasion tend to be a little, and I know this sounds far more derogatory than I mean, but she can on occasion tend to be a little hair on fire.
Drama queen.
If you know what I mean. So first of all, like on a 1 to 10 scale, this brain-eating amoeba thing, how concerned should people, well, today in Bossier be?
I would say a 1 or a 0.
Really?
Yes. Okay, so let's talk about this. In 10 years of tracking this disease, only 34 people have been diagnosed with it.
But what happened to those 34?
Only 34. Well, let's see, 29 of them died. 5 of them have survived. So, yes, if you get it, the chance is very high that you will pass from it. However, 34 people in 10 years and all the millions of people in the United States.
Okay, Martha. Dumb question. You know, I'm not the brightest on the medical front. I don't understand how you can still drink the water, but it can't go up your nose. Can you explain that in the simplest of terms?
Well, the amoeba can get inside you if you drink the water, right?
Right.
But the amoeba has to get up to the frontal part of your brain. So what it needs is to go up your nose into that frontal axis of your brain. So if it can't get there, which it's not going to by water because you're going to drink it and it's going to pass out of you, right?
Right. Okay.
Pardon me, Martha, why just brain tissue as opposed to intestinal tissue or stomach tissue or anything else?
I don't know. That's what it's decided it likes.
Okay, what about getting the water in your eyes or ears? Does that get to your brain?
Really, they have not found any evidence that unless you get it way up your nose and even so far that you, gag from it. So, for example, if you use a neti pot and you squirt it up your nose, or if people who, for example, are water skiing in a lake sometimes, if they get dragged, they'll get water way up their nose where they're coughing and gagging.
So, I mean,
that's the kind of exposure we're talking about.
Where it's got to get into your head, so to speak, to attach itself, for lack of a better term, that's really hard to do, I guess.
Yes.
Okay.
It is. And I don't want to diminish for those, because there are people in our community who did lose a loved one. So I don't want to diminish it for those people. It is, a significant disease. However, your chance of getting it is extremely low.
Okay.
And what you'll find is Bossier is going to be upping their chlorine in their water to the point you'll probably smell it when you run your water. You may, some people rarely see a little change in the color of their clothes. Not very often, but we have had some complaints about that. But they up their water chlorine level to a 1, and they'll keep it there for a month, and then they'll retest for the amoeba. So they're going to really be cleaning out that water system and making sure that there's no place for that amoeba to hide and grow.
Okay, my worry is amoeba kind of to me sounds like a roach. If you've got one amoeba, you've got cousin amoebas. Where are the cousins?
Well,
yeah, that's a really hard question to answer. Let me try this. Is there any chance that what causes it in the first place?
To get in the water, yeah.
What are the, I don't want to say climatological...
well, it's naturally in the dirt. It can get in, it likes fresh, warm water. Why it grows in our water systems, what we found is it grows kind of more in the distal portions of our pipes. So, if you lived on, in a rural area where maybe there's not as much water flowing through the pipes on a regular basis, that's where we've seen it the most. Bossier's a little bit unusual, so they're going to be doing some good looks at exactly where they found it to make sure that the chlorine is getting to that level. But what happens is the water doesn't flow as much. You get a little biofilm, is what it's called, and the amoeba grows on that little biofilm.
And I had seen Aaron had just mentioned a couple of seconds ago before we started that it is predominantly or exclusively, you tell me, in the South. Does that have to do with the humidity, with the warmth? What is how does
it
that?
It has to do with the temperature and the environment that we have the environment the amoeba likes to grow in.
Okay.
Just like mosquitoes.
Right. Let's talk about the testing, because people are saying, if there's an amoeba in Bossier, could there be one in Shreveport? Has Shreveport's water system been tested? How regularly are these tests done?
So we test around the state regularly. So they go out multiple times a year. They do multiple testings, and what they do is they randomly pick water systems to test. Bossier was not on the list, but because they sell water to Sligo, that's how they got tested. It doesn't mean that, the truth is nobody's been sick from water in Bossier, but we're going to continue to monitor all the systems. It's just, we have over 500 water systems in Region 7. We can't test each one
When's the last
every
time
month.
When's the last time the Shreveport
system?
system?
Pick.
When's the last time the Shreveport system's been tested?
I don't know I don't know the answer to that, but I do know that their chlorine levels are tested monthly. Every water system's chlorine levels are tested monthly, and that's what we want to make sure are good. The chlorine level in Sligo, where they first found it, was low. So, and that's what I mean. Sometimes we don't get that flow out where we need it. So they're flushing the lines. They're flushing with a lot of chlorine, and we're going to get rid of that amoeba.
Okay. And this chlorine will kill it. You're pretty confident of that.
Yes, and we've shown that. So we've had it growing in an area. We've done this exact protocol, and it's all done in discussion with CDC and EPA and all of those letter words, whatever. And we've shown that it's been successful.
You have personally, I think you've done quite an excellent job of putting out the fire in Aaron's hair.
Yeah.
Thank you very much.
I hope so, and I hope I was clear.
So I can take a shower now.
Oh, absolutely.
It's been 5 days. Thank God.